Hello, my name is Mark Lewinter, and I'm a licensed acupuncturist. I've been practicing acupuncture in the state of Georgia since 2001. What I'd like to do today is talk with you a little bit about acupuncture, and it's my hope that by the end of today's lecture that you'll feel comfortable with acupuncture and be able to refer your clients who are interested in acupuncture to a safe, well-qualified acupuncturist. Before we get started talking about acupuncture, I wanted to share a little bit about my personal story and how I got into acupuncture. I started becoming interested in health at age 13 when I was diagnosed with Burkitt's lymphoma, a type of cancer. I was treated successfully with chemotherapy. There's a picture of me there at the Boston Children's Hospital in 1987. During that time, I learned a lot about health, like health is not something that you're guaranteed and something that it's very easy to take for granted. But I'm pleased to say that the chemotherapy was very successful and the cancer was cured. At age 16, I experienced acupuncture for the first time, and I remember walking out of the acupuncturist's office, and I said to my mother, who was with me, I'm going to be an acupuncturist. And she said, "Oh yes, Mark, that's quite nice. You can do whatever you want to do." And I said to her, "No, I'm going to be an acupuncturist." There was something that was very meaningful that happened. I was able to connect with a part of myself that I wasn't able to connect with ever before, and I knew that I wanted to know more about that. I went to college right after high school, majored in chemistry, and then went directly to acupuncture school, which was a 3-year master's level program. And in 2001, I joined Metro Acupuncture. Since then, I've served as a 2-term member of the Acupuncture Advisory Committee for the Georgia Medical Board. I'm also the first licensed acupuncturist to be credentialed at the Children's Hospital in Atlanta. I was doing some rough calculations in preparation for this lecture, and I think I'm at about 15,000 acupuncture treatments, which is always fun. If you're a practitioner and haven't done that little calculation, it's interesting to think, wow, I've treated this many people. So, everybody wants to have more and more experience, but I think the only thing that can give you experience is just time. I'm also a fellow of the American Board of Oriental Reproductive Medicine. I became a fellow of that board in 2009, and I am an employee also at the Atlanta Center for Reproductive Medicine, where I help women using acupuncture who've been diagnosed with infertility. I have been working with patients at the cottages at Mountain Creek since 2011. So I wanted to share with you 3 different types of practitioners that may practice acupuncture in the state of Georgia and how they became licensed. So someone such as myself, a licensed acupuncturist, trained for about 3,000 hours total in acupuncture and herbal medicine, and then became a licensed acupuncturist. Medical doctors in the state of Georgia can become acupuncturists after a 300-hour program. And I think this is appropriate because of the years of training that they've had and the awareness of the anatomy. And I've actually seen some of this program, and it's quite rigorous. The thing that gives me pause and some questions is that physical therapists in the state of Georgia can practice something called dry needling, which is essentially using an acupuncture needle at a trigger point or an acupuncture point and going back and forth with that with just a relatively short period of about 50 hours. The reason this gives me concern is, there's many reasons, but I wanted to share with you this unfortunate story of a Canadian whose life was radically changed for the worse acupuncture treatment. She went to a massage therapist. The Olympian was having some headaches, and she saw a massage therapist, and the massage therapist offered acupuncture. Unfortunately, the massage therapist had only had about 174 hours of what he calls self-directed home study. So not a lot of time, and home study study versus spending time with the teacher. The acupuncturist inserted a 2-inch needle between the clavicle and rib, so a 2-inch needle, and went in. Unfortunately for everyone, when this acupuncturist inserted this needle, it punctured the lung and caused a pneumothorax. The patient went to the hospital, experienced an infection, and now someone who was an Olympian currently has shortness of breath simply with climbing stairs and frequently has to use an inhaler. So a serious injury that happened from someone who wasn't paying attention, wasn't aware of anatomy, and now a patient has suffered. So I do believe that it is really important that when we refer to acupuncturists that we refer to someone who is skilled and has proper qualifications. Qi is a science of acupuncture, and I wanted to demystify the character for Qi. The character itself is made up of 2 parts, and I've broken those parts down. This is the character for Qi, and then it has 2 parts. This is the character on the top here is the character for gas, and then below here is the character for rice. So when we think about Qi, Qi is energy, Qi is the life force. Qi includes everything. It includes the planets, the stars, the galaxies, on and on. It is all matter and all energy. Well, in Chinese medicine, what they saw is that Qi is the result of eating and breathing. And it's certainly been my experience that if I don't eat, my energy gets low. And if I don't breathe, my energy gets low even quicker. So I believe that it's important for us to know that that Qi is not something mystical. It's something that occurs between us, and it's something that is everywhere, and it's in all life. But I don't want to just rely on the Chinese myth and superstition. I live in a world where I'm very interested in a scientific explanation. So I wanted to offer a scientific explanation as to what the acupuncture needle may be doing biologically. And the neuroscience of acupuncture says that acupuncture affects neurotransmitters such as serotonin, dopamine, substance P, endorphins, and others. So this is one of the reasons why after one leaves an acupuncture treatment, they'll feel so euphoric. Something that I thought was quite interesting is a type of endorphin, beta endorphins, are 80 times more potent than morphine. So it's quite nice that we can give someone a rush of endorphins and they're able to have decreased pain without any negative side effects. Acupuncture also stimulates many of the body systems, such as the endocrine, immune, nervous, circulatory, and lymphatic systems. The thing that is really important to know is that acupuncture is an energetic medicine that improves body function. I think it's quite interesting to know that a lot of acupuncturists use meridian theory. I myself believe in the meridian theory, and I've presented 3 different meridians that would be used during an acupuncture treatment. In terms of how these would be used for someone who's been diagnosed with mental illness, the first meridian, I might be more likely to do points on this meridian if someone is very irritable and angry. The second meridian, I might lean towards using these points if someone is obsessed and worried. And then the third meridian, I would use these points if there was a lot of fear and nervousness. A lot of the ways that acupuncture works is similar to the way that meditation works. So I wanted to share with you a little bit about some of the science of meditation, and I thought it was quite interesting. I myself meditate Monday through Friday for an hour every morning, and I can tell you that it's a wonderful thing, and it's also very challenging. But I do believe that it helps with brain chemistry, and it helps with me being a better practitioner. So a successful meditation starts off with high beta waves, which is conscious thought. And I'll experience this myself. I'll sit down to meditate or even get an acupuncture treatment, and I'll think to myself, what is it that I've got to do today? I wonder what that person meant when they said that. Boy, I'm a little bit uncomfortable. Maybe I should adjust myself. No, I promised that I wouldn't adjust myself. So it goes on and on for a few minutes. And what I've recognized is that this isn't something that I really need to pay attention to, and it's just not that important. So the conscious thought I let go. Then in an ideal meditation, we experience more alpha waves, which is sort of like a spacey, dreamy state. So it's like I still may be thinking about, you know, the grocery list, and I still might be thinking about my knee, but it's like I can feel this and it just doesn't really matter much anymore. And then finally, and this is what we all want to get to, not that getting to a certain place in meditation is the goal, but it's certainly nice when it comes, is when the brain starts producing more of these delta waves, which is deep unconsciousness, intuition, and insight, where all of a sudden you had writer's block and it's just like the answer is there, or you feel free in a way you never felt before, or there's just this deep floating peace. This is what I believe I felt during my first acupuncture treatment, and why I walked out of there certain that I wanted to be an acupuncturist. Okay, so I'm going to talk about acupuncture and its role in helping patients who've been diagnosed with mental illness, but I wanted to define mental illness, at least according to Mayo Clinic, and they define mental illness, it refers to a wide range of mental health conditions, disorders that affect the mood, thinking, and behavior. So that sounds pretty reasonable. And also, examples of mental illness include depression, anxiety disorders such as schizophrenia, eating disorders, and addictive behaviors. So I thought that was nice to at least set the foundation for that. But the thing that I felt like was more important was this little picture, which just shows my experience on a daily basis with so much coming in. Like, you know, oh, did I pay that bill? Oh, is my cell phone battery gonna work? What's traffic gonna be like? How many more patients do I have to see? And it's just, you know, it goes on and on and on. And I think that we really tax our brain, and that's why meditation and acupuncture, I believe, can be so helpful. Now, I'm not here to say that acupuncture is a cure-all. I believe that would be foolish. And I present a couple examples of patients. So I have been able to help a lot of patients who've been diagnosed with cancer and are undergoing chemotherapy with their nausea in a significant way. But I've never said to any of those patients, don't do chemotherapy, only do acupuncture. And the same is true for asthma. Patients who want to have improvement in their breathing and also get over colds quicker. I have been able to help those patients, but I never say don't take any of your asthma meds and use your inhaler. And you know, I just to reinforce the example, several patients that I've seen with MS, I've been able to help them with their fatigue, but I haven't said, you know, don't go to a doctor and don't follow up with that care. And the same truth goes for patients who've been diagnosed with mental illness. From my experience, acupuncture is a supportive therapy, and a holistic, multifactorial approach is best. So, there are a couple different ways that one can get acupuncture or receive acupuncture, and what I'm going to present is whether one should do individual acupuncture treatments or group acupuncture treatments. Let's look at the pros and cons of each. With individual treatments, which is what we provide at our clinic, the first treatment is about 90 minutes and the follow-up treatments are about an hour. With individual treatments, there is a higher cost, but there's much more individual attention, and we're able to customize treatment. So if the patient comes in with anxiety one day, we're able to do different points than the previous time we saw them where there was just a lot of fatigue. The patients may be able to be less self-conscious and relax more into the experience. And I gave an example just thinking about like, well, what type of patient would benefit more from just the one-on-one acupuncture treatment, the individual treatments, and that's perhaps someone who has a high level of anxiety and needs a lot of attention. Group acupuncture is becoming more and more popular, and here are some of the benefits of group acupuncture. It's a shared experience, so everyone's in the same room, everyone's being quiet, there's an intersubjective field being created, and it's quite healing. It's a lower cost because the acupuncturist is able to see many patients at one time. The treatments are a little bit shorter, about 45 minutes, because there's not as much talking time and the patients don't need to change. The group acupuncture is very effective for improving group cohesion. It's incredibly easy to incorporate into a residential treatment program and provides a certain level of emotional team building. You know, if you've ever meditated in a group, it's wonderful knowing that you've shared this experience with other people. And then a particular type of patient or a class of patients that might benefit from group acupuncture is perhaps someone who is going through a program detoxing from drugs and alcohol, or someone who's been diagnosed with post-traumatic stress disorder. I think that it's important to talk about acupuncture studies, and I'm going to share with you a few interesting acupuncture studies. But before we talk about acupuncture studies, I wanted to share with you some of the pros and cons of doing acupuncture studies. So, of course, the pros would be that it provides what so many physicians are looking for: evidence. It shows that acupuncture does work. It also gives a greater level of acceptance because there's a study, and the studies can make headlines. And then we are wanting to show that acupuncture is better than placebo. And this is all very important. I'm totally in support of acupuncture studies. But there are some things that can get in the way, and some obstacles of doing acupuncture studies. One is that everyone gets the same points. There's no customization. So we're doing the same treatment for every single person, and not every single person is the same. There's the double-blinded placebo-controlled studies have challenges, and even where there's the single blind, using something like sham needles, where it's not a real acupuncture needle, but the needle goes in and then out. This may not be inert, and perhaps just piercing of the skin is creating a change. And the studies force acupuncture, a 4-quadrant medicine, into the upper right quadrant, which is just saying, what is it doing? When patients have been diagnosed with mental illness, they may have additional problems that they bring to the table, such as chronic pain, side effects from their medicines. Their medicines may stop working and they need additional medicines. And I believe that acupuncture can help with all these things. Acupuncture certainly can decrease pain, and I'm going to share with you a study about that. I'm going to share with you an example of how it helped reduce the side effect of some of the antidepressants. And most importantly, I think, is that acupuncture encourages an integral approach, so the patient feels more whole. This is a quotation by Joseph Helms, and Joseph Helms is a medical doctor who has taught over 15,000 medical doctors acupuncture. And Joseph Helms says that acupuncture analgesia is probably the most thoroughly researched physical modality in medicine. More is known about its mechanics of action than about those of many pharmaceutical agents in routine use, especially the anesthetic gases. So I can tell you, for 40 years, acupuncture has been well studied, and it's been well documented, and it's just been proven to be effective for pain relief. But I'd like to share with you a recent study. I found this study on Mayo Clinic's website. It was published in 2012 in what's currently known as JAMA Internal Medicine, formerly known as the Archives of Internal Medicine. And what the researchers wanted to do is determine the effect of acupuncture for 4 chronic pain conditions, which are back and neck pain, osteoarthritis, chronic headache, and shoulder pain. So they gathered data from 29 randomized controlled trials totaling 17,922 patients. And what they found is that acupuncture is as effective for the treatment of chronic pain and is therefore a reasonable referral option. Significant differences between true and sham acupuncture indicate that acupuncture is more effective than placebo. So this is very encouraging. If you have someone who is not able to engage in group, say they're in a residential treatment program for mental illness and they're not able to engage in some of the group activities because of pain, have them try acupuncture. It can help reduce the pain. They'll be more comfortable sitting in the chair. They'll be more comfortable with various activities of daily living, and then I believe more receptive to the treatment. Now, negative side effects from some of the antidepressants are well known, and I thought that this study was very interesting as to how it was able to reduce some of the negative side effects from antidepressants. So in this study, they looked at sexual dysfunction secondary to antidepressants and how acupuncture could help. The study was done in Toronto, Canada, and one thing before they did the study is that they noticed that the SSRIs and SNRIs are known to cause secondary sexual dysfunction with prevalence rates as high as 50 to 90%. So the purpose of their study was to examine the potential benefit of acupuncture in the management of sexual dysfunction secondary to SSRIs and SNRIs. So all the participants were experiencing adverse sexual events from their antidepressant. They received acupuncture for 12 weeks, and the results, I think, were quite interesting. There was significant improvement among male participants was noted in areas of sexual functioning, as well as in both anxiety and depressive symptoms. Female participants reported a significant improvement in libido and lubrication and a non-significant trend toward improvement in several other areas of function. So I was very encouraged that if someone's taking a medicine, the medicine's helpful, but it's producing a lot of negative sexual side effects, this study showed that acupuncture can help. Acupuncture being safe and effective when done by a qualified, skilled practitioner. I'm glad to see that this is something that we can now offer patients. For the next few slides, I'm going to talk about schizophrenia. I think one of the more complex conditions to treat, but I'd like to see if we can look at it from a few different angles. So the first thing I want to share with you is that about 10 years ago, a landmark book was published in the United States called Soothing the Troubled Mind. It's a translation from a Chinese text that was published in 1987. It gives practical philosophy of Chinese medicine and what it has to offer for the patient diagnosed with schizophrenia. The therapies were I find that the therapies that they talked about and the results that they got were fantastic. And I think there are several reasons why they were fantastic. Is because acupuncture is very well supported in China. It's part of their culture. So the acupuncturist would be working alongside the physician in a hospital, and the patients would be getting treatment every day. When you read this book, and I encourage anyone who's interested in acupuncture and schizophrenia to read this book. I've read no other like it, where they're creating an environment for real healing, and there's even some case reports where they have cured schizophrenia. I don't believe that this is clinically possible. What they've achieved is clinically possible here in the United States because it's just from a different culture. And one example of how different the treatments are is in the book, and they talk about many different types of therapy, but one type of therapy they talk about is a 5-person therapy where they have the patient lay down on a table. They bring 5 acupuncturists. Acupuncturists surround the patient, and they all place needles in this patient. So the level of care that they're able to give just wouldn't be available in the United States. But they have many reports and a long history of successfully reducing some of the symptoms of schizophrenia and in some cases curing schizophrenia with acupuncture and standard Western medical treatment. So that's quite interesting, but I'm not sure that it's something that we could do here in the United States. This is a recent study that was published in 2011. It was done in Tunisia. The picture on the top is the hospital where the study was done. They used 31 patients. 15 were treated with acupuncture and 16 were treated with sham acupuncture. There was a total of 10 sessions, so a pretty short amount of sessions, and over a 3-week time period, so also a relatively short time period. They tested them before and after. They were tested on the 1st and 23rd day, and what they found is that acupuncture was not very helpful for reducing schizophrenia. Now, I could have told them that. I could have told them that after 10 sessions, 3 weeks total, that there probably wouldn't be a change in their schizophrenia. But I do believe that there would be an improvement in their energy. I do believe that there would be a sense of hope. I do believe that it would be improved sleep, relaxation. So I think that the researchers here were overly ambitious. And I just wanted to note that per these criteria, the antipsychotic medicines would be proven ineffective too if they were held to just a 3-week time period. I think this is the last study that I'm going to be talking about, and the study that I'm most excited about. It came out just 3 days ago, so I was very happy that it was published before I had to finalize the lecture, and I wanted to go over it with you because I think it's quite meaningful. So this was a study that was done in the United Kingdom, and what they stated a few things that are mind-blowing, that depression will be the second leading cause of disease burden worldwide by 2020. It is the third most common reason for primary care consultations. Antidepressants are the frontline treatment in primary care, yet an inadequate response to antidepressant treatment has been reported in up to 60% of patients. So their study design was a randomized control study. They looked at 755 patients, and there were 3 groups. The first group just took antidepressants. The second group took antidepressants, plus they received counseling. And then the third group took antidepressants, and they had acupuncture. They were diagnosed with severe to moderate depression, and the patients were treated weekly for 12 weeks. The thing that I also think was wonderful about this study, and you don't find this in acupuncture studies, is the acupuncturist was able to customize the treatment. So they were able to do the exact points that they felt the patient needed. So the results were that in the acupuncture group had a statistically significant improvement over the other 2 groups at 3 and 6 months. Unlike most studies, I think I mentioned this already, I know I did, is that there was individuation and of the acupuncture treatment. I've included a picture just so you can have a place of the school where this study was done. This is a little flow chart. I, of course, don't expect you to be able to read this, but it's just showing that this was a very serious study. It was looked at from many different angles, and I think it's a well-respected study that we'll be hearing a lot more about. This is a graphic showing the results of the study. The dotted line show the results of patients who just took medicines. The middle line or gray line is showing patients who took medicines and got counseling, and then the black line, the bottom line, which shows the most improvement, is patients who received acupuncture and took medicines. So, I wanted to share with you a few studies about how acupuncture is helpful for mental illness, and studies are very challenging. And working with patients who've been diagnosed with mental illness is very for several reasons. It doesn't always provide quick results, especially in patients with chronic, severe, and disabling brain disorders like schizophrenia. Unfortunately, it requires frequent visits. This can be costly, and improvement may be subtle at first. So, someone may be having more energy, but they're still saying, but I'm having all these other symptoms, and it requires a certain level of patience. Acupuncture, especially in the United States, for some can challenge cultural values. But just because something is challenging doesn't mean that we shouldn't do it. My experience in working with patients with mental illness in the clinic is that there's increased hope and focus after the acupuncture treatment. They may still have, they of course still have all the problems, but there's a stronger foundation to be able to work through their problems. There's a decreased sense of overwhelm. There's a sense of empowerment that they can actually move through the obstacles that they felt like they couldn't face before. Working with patients with mental illness is something that has always been a part of Chinese medicine, and the points that are hundreds, sometimes thousands of years old, the name of them represent that. Points like gate of life, empty basin, broken sequence. It's so great that I'm able to see a patient, and they may say one particular thing, like, I was on this path, and then something happened. There was an accident, and I haven't been the same since. And I think about, okay, broken sequence, and I do that exact point, and listening very closely to the patient, it guides me to the point that should be done. Another example would be, I feel so empty. I feel like totally drained. Therefore, I might do empty basin. Another example is a point they say that I'm just haunted with these thoughts that I can't get over and these mistakes that I made, and it just keeps me up at night, and I just wish I could let go of it. I may be inclined to do the point called spiritual burial ground. So acupuncture is something that I've personally found very helpful. I really enjoy giving. I really enjoy caring for patients in this way, in that I'm able to spend a lot of time with them, I'm able to connect with them at a deep level, and I'm able to make a difference in their life. So that makes my life a life worth living. So, thank you very much for your time. Now I'm going to be doing a demonstration on acupuncture.